Hi there, my name is Bilal, and today I'm going to give a little insight into what acute spinal cord injuries are, how can they be treated and diagnosed, and what the future holds for us in terms of advancements in treatments. Before we get into that, we must first understand what is an acute spinal cord injury, also known as a SCI. A SCI often occurs due to traumatic injuries that bruises or partially and completely tears the spinal cord. These often result in either temporary or permanent disabilities depending on the severity and location. In some cases, it can be met with a fatal outcome. But why should we care? There is approximately 380 cases of spinal cord injuries reported each year, with one new injury each day. 20,000 people currently living in Australia with spinal cord injuries. This condition has been considered to be robbing the youth, as the average age of a person suffering from SCI is 15 to 24 years of age. It has also been recorded that males are 4 times more likely to acquire an acute spinal cord injury than females. What exactly leads to an acute spinal cord injury? The bulk of these cases is due to motor vehicle accidents, making up 39% of traumatic SCIs. On par with 39% is the result of falls, with the majority of cases occurring in older population. Making up the remaining number of cases each year is sport-related incidents and acts of violence. To understand the science behind this condition, we must first know exactly what is the spinal cord. Well, it is a column of nerve tissue that runs from the base of the brain down the center of the back. Its function is to transmit signals around the body, allowing for sensory function and movement. It can be seen as an electrical wire running from a computer, being the brain, down the body, allowing everything else to work. If that wire is cut, then no messages can be transmitted from that computer to anywhere else. This damage can result to a range of symptoms: muscle weakness, loss of voluntary movement such as arms and legs, loss of bowel and bladder function, and breathing difficulties. Your ability to control your limbs after a spinal cord injury depends on 2 factors: the place of the injury along the spinal cord and the severity of the injury to the spinal cord. There are 2 types of injury classifications in SCIs, with those being complete and incomplete. Complete includes total loss of movement and touch in infected areas, whilst incomplete is if there is some loss of movement and touch in those areas. The degree of loss in movement is also classified with terms such as quadriplegia and paraplegia. Quadriplegia is a total loss of movement in all 4 limbs, while paraplegia is a loss in lower limbs below your waist. The degree of SCI is significantly determined by how quickly the disorder is diagnosed and the measures that are put in place to reduce further damage. The presence of SCI at the location of trauma can be detected by testing the patient's strength and sensation in their arms or legs. Loss of sensation and muscle weaknesses give an indication that there might be an issue regarding the spinal cord. A more clear and concise method of diagnosing an SCI is through the use of X-rays in the form of a CT scan to identify fractures or bone abnormalities. An MRI can be used to look at the spinal cord itself, detecting any abnormal masses that may be damaging the spinal cord. Treating an acute spinal cord injury is vital from when it is first suspected. The spine of the patient should be immediately immobilized at the scene of the trauma. This is usually done with the cervical collar around the patient's neck and a flat backboard to allow for transportation. In the case of no equipment being available, the patient's head should be held still, limiting possible movement that may worsen the injuries. In some cases, surgery may be required to assess the patient's injuries and to help stabilize the bones and damage. Unfortunately, there's no way to reverse the damage to the spinal cord, but researchers are continually working on new treatments including prostheses and medications that may promote nerve cell regeneration or improve the function of the nerves that remain after a spinal cord injury. In the meantime, spinal cord injury treatment focuses on preventing further injury and empowering people with spinal cord injury to return to active and productive life through supportive and rehabilitative care. However, the future for SCI treatment is looking bright with a variety of studies and tests being done. Recently, a series of studies have shown that an implantation of a stimulator, known as epidural stimulation, this implant is surgically placed in the lower back of the spine and emits electrical current through the damaged spinal cord. Results have shown the restoration of motor and sensory function in patients, with some being able to walk again. However, results did vary and is still in trial stage amongst researchers. Another promising treatment has been due to advancements in genetic and precision medicine. The use of gene therapy to help repair the damaged neurons showed to be successful in animal trials where completely paralyzed animals were able to walk again after a couple weeks of treatment. Whilst these future advancements in treatments are on the horizon, the best treatment for SCIs is its prevention. Being cautious on the road and putting measures in place in terms of falls is just a small price to pay when a potential SCI is on the line. Of course, further research is significantly needed to better understand acute spinal cord injuries and to create better advancements in treatments. This life-changing disorder has been increasing ever so slightly over the years. Hopefully, this little insight into them has allowed for an eye-opening experience. Thank you very much and hope to see you again.